More than a year ago, 2 youth services in Cairns decided to do something about the number of young people sleeping rough in their region. Inspired by the success of a program developed in the United States, they gave 10 young people a roof over their heads. It's not free. Those participating in the pilot program pay a quarter of their income for the Department of Communities and Housing. But as Sam Davis found out, the results have been life-changing.
Without this house, I would probably still be on the streets. But ever since I got this house, I've been just 100% A-OK and living life, yeah. It was really, really, really great finding out and moving into this place. It was the best news I've ever heard in how many years? Yeah.
For 8 months last year, 23-year-old Kayleen Query was pregnant and homeless. Living on the streets of Cairns with her boyfriend, she says, was tough.
One of our spots we went to was the Martin Street hockey field. That was, that was at the last 8 months we stayed there because that was the safest and the openest place and the warmest place because it had the big shed and, we all just slept together underneath.
Having exhausted all other ways to escape the streets, Kayleen approached Yeti, a local youth service, to help her find housing. Genevieve Sinclair is Yeti's manager.
Kayleen has been attending youth services for a number of years. Kayleen is just a really great battler. She's had some, really hard struggles. We were trying really hard for her to access private rental options and the crisis accommodation system. She was with her partner and for long periods of time was rough sleeping in parks, and we'd frequently find her in the morning on the back steps where she was sleeping on the back steps of our old building.
Needing a long-term solution, Genevieve decided to place Kayleen in a new trial program called Bridges.
Bridges is a collaboration between a number of non-government organisations in Cairns, primarily the 2 youth work agencies, YouthLink and Yeti. And we have a belief that when young people are housed, particularly really vulnerable young people, that we can then try and stabilise all the other factors around them that might have led to their homelessness or that are exacerbated by their homelessness, particularly their substance use, their relationships with family and friends and their mental health.
YouthLink's Sam Karam is the facilitator for Bridges.
We don't want to let them totally go alone. It is a big change for young people to move into a tenancy after many years of homelessness, but we wanted to be also coordinated around that. Multiple agencies working together efficiently to assist those young people to work through any issues that might arise.
Through collaboration with other services, many of the young people in Bridges receive treatment for substance abuse, mental health issues, and are taught basic life skills. 1 year on, though, Sam says those in the program are far less dependent than they once were.
What we have found since then, that the need has dropped off quickly. The need for support has, whilst there's a commitment to ongoing support, we're not closing cases, the demand on the services has dropped from those young people. And I guess the demand from those young people has been extremely high in the past through just cycles of homelessness, the need for some forms of shelter, emergency responses to their needs, whereas now with the tenancies and with coordinated support, that need seems to have dropped.
But despite positive early signs, Genevieve Sinclair says she's wary of calling it a standalone solution to youth homelessness.
I wouldn't like to claim it a success at the moment. It's obviously in a pilot trial phase. And we're just really hopeful. The outcomes are really encouraging. We have only lost 1 tenancy out of the 9 or 10 that we've had running for a year. And some young people that we really thought were really going to struggle to maintain accommodation have done amazingly well. So, and I guess their continued accommodation, some of the tenancies have been running for over a year, have led to massive reductions in substance use, into engagement with the criminal justice system, and in terms of their primary health outcomes has been really encouraging. But we try to be a bit humble about it because, we do expect there to be failures.
As for Kayleen, she says Bridges has helped put her life back together so she can focus on more important things. like being a mum.
I'd say housing is 100% important to me because it was really hard trying to keep warm, trying to keep clean, trying to stay out of trouble and stuff. But now that I've got this house, I've actually been out of trouble for at least a year now, maybe 3, and yeah.